Good afternoon and welcome to FHCA's webinar, Creating a Culture of Safety. I'm Kristen Knapp, Senior Director of Strategy and Communications for Florida Healthcare Association and your moderator for today. And our presenter is Barb Pusateri, Clinical Nurse Specialist with Medline Industries. Before we get started, I want to go over a few housekeeping items. To help our program run smoothly for you, we want to remind you that all attendees are muted due to the large number of participants. And we encourage you to use the computer audio rather than a phone to maintain sound quality for today's presentation. You can ask questions throughout the presentation by typing into the question box, and the slide that you see now shows you how to submit a question using that Q&A question box. This webinar is being recorded and an online archive will be available on the FHCA website along with additional handout materials. So if you have a colleague unable to join, please encourage them to view the recorded webinar. Today's program is brought to you by the Caregivers Florida Career Program, which is the CMS-funded grant program that FHCA's Education and Development Foundation is sponsoring in partnership with the State of Florida Agency for Healthcare Administration. If your facility is not already signed up as a participating provider, you can do that through our website at florida.carefortheaging.org/employers. And you get access to free resources such as connections with job seekers, job posting on our career center, recruitment promotional tools, and also happening this month is the free use of an employee satisfaction survey. So between now and March 6th, all of our nursing home members can use this free employee satisfaction survey to share with your employees to gather their feedback. And we have promotional resources available to help encourage their participation. After the survey closes, we're going to compile that data to provide to each of our facilities to help inform their workforce engagement activities. And then we take statewide data to inform our programming for this upcoming year. And it's important to note that your employees' feedback is anonymous. We don't share any of your facility data with regulatory agencies or others, and all of the information is aggregated. So if you are a participating provider, you're a nursing home member and have received our emails about this survey, we encourage you to take advantage of this free benefit and share it with your employees. So, okay, we are ready to get started, Barb, and I will turn it over to you.
Okay, well, thank you so much. So thank you everyone for attending our presentation today. I'm going to be talking about creating a culture of safety. So in today's presentation, I'd like the objectives to be after the program for you to understand the data around staff injury and risk, acknowledge the best practices for implementing a safe-based program in your facility. We're going to learn some tools that are available in the industry to help improve safety and to help improve retention of our employees. And then we're going to learn ways to keep safety as the basis of our organization's culture. So nurses and nursing assistants have had a very high risk for injuries. And I think that's because of all the repetitive tasks that we do every day to care for our patients. And nursing assistants, it's hard to believe that, our jobs can be dangerous. We perform a lot of lifting, bending, twisting in our jobs, and we're at risk for injuring ourselves if we don't have tools and if we don't practice good techniques to keep ourselves safe. And believe it or not, nursing assistants actually have our higher rate of injury and have higher workday injury rates and loss of work days. So we're going to talk about why all this is occurring. So let's talk about why are caregiver injuries so common? Well, when you take a look at this slide, I've seen this slide several times, but it's one of my favorite slides because, it really highlights the caregivers and our risk for injury when compared to other industries and other jobs. I mean, when you think about jobs that are manually, labor intensive and they're risky and dangerous, you don't necessarily always think about a nurse or a nurse's aide or an orderly. We do think about construction workers, police officers, firefighters. We know that their jobs are labor intensive. I mean, firefighters, my God, they're carrying people out of burning buildings, saving people. And then, police officers are chasing people down. construction workers. They're moving heavy, steel beams and other types of products that they work with. So we've heard about, the injuries that can occur in those industries. But if you look at the slide, you can see that healthcare workers often experience greater musculoskeletal injuries and disorders than all these other workers combined. And according to the American Nurses Association, more than 1/3 of the back injuries among healthcare workers occur because of all the frequent patient handling that we do. So why are we incurring all these injuries? Well, as you look at the map here of our country, and this is a map that highlights the obesity rates in our country, you can see here that Florida is surrounded by all these states in the southeast that are rated as having the heaviest patient population. That orange and then that red color shows you some of the highest rates of obesity in our country. So, with obesity on the rise, I mean, we've got all this great education about, the exercise and nutrition, but we still have a very obese population. And guess what? Our population is getting bigger. And in addition to that, people are living longer now. So we have more individuals and residents residing in our nursing home. So sometimes we're in a facility where we don't have the equipment that we need, or it's not appropriate for what we need to do. And nurses and nursing aides just have this philosophy or this culture of thinking that, well, we just do what we've always done. We just move patients, we just do it. So let's talk about what we can do. Okay, so what we do now, providing our care in the nursing homes and facilities, as I mentioned, it's very physically demanding. We have to help a lot of our patients with mobility because many of our patients and our residents, they're totally dependent on us for mobility, on the caregivers. So a lot of the tasks that we do are repetitive and they're very manually labor intensive. We have to reposition residents, help them get up. We have to help bathe them, help them with their daily tasks of living. And so performing these repetitive tasks can lead to low back pain, sciatica, rotator cuff injuries, epicondylitis, and carpal tunnel syndrome. Oops, skip one slide. So, oops, sorry, I'm sorry, guys, I'm skipping some slides. So I want to talk about a safe patient handling program, and a culture of safety. But before we get to that, I'm so sorry. I want to talk about the costs that are also associated with injury rates. So if you look at the number of workman comp claims that risk managers and facilities have to deal with, or that they look at, a lot of them are due to patient handling. So patient handling has one of the highest claim rates, and even one claim can cost in excess of $15,600. But besides the actual workman's comp claim itself, there are also so many indirect costs that can occur when we have our staff getting injured from moving patients. And the indirect costs can be 2 to 4 times actually higher even than the actual cost of the injury. So there's a cost associated with our staff getting injured as well. So what can we do about it? Well, to reduce some of those safe patient handling injuries, we can incorporate a safe patient handling programs. Programs have been proven to reduce injury rates. And what does a program actually consist of? Well, it's creating policies that can eliminate manual lifting and handling when possible. Some facilities look at having a lift team. It's really also in creating a lot of training and constantly training our staff about how to handle patients. It's an investment. We have to have leadership behind us, but it's an investment in some safe patient handling equipment to reduce some of the injuries. And believe it or not, the rate of return has been shown to impact patient injuries and clinician injuries in our facilities. And the rate of return on investment is about 3 to 5 years. Sorry, these slides keep advancing a little faster. So what can we do about it? Let's talk about creating a culture of safety. So when we think about a culture of safety, let's really talk about what that is. So a culture of safety is really designed for that those are people that are encouraged to work towards change and to take action when it's needed. So inaction in the face of safety problems is taboo. And eventually pressure comes down from all directions, from our peers, as well as our leaders. There's no room in a culture of safety for those people who uselessly point fingers or say, safety is not my responsibility. I'll file a report and wash my hands of it. So culture change is the process that your organization takes to encourage employees to adopt new behaviors and mindsets that are consistent with the organization's values and goals. So it's necessary to change behaviors of employees. And some of the things that we can do to create this culture of safety is look at the number and severity of injuries that are occurring to our residents in our nursing homes that can be reduced. OSHA recommends manual lifting of residents be minimized in all cases. OSHA also recommends that we develop a process for systemically addressing ergonomics in our facilities. And to create this culture of safety, we can't do it without having the support of management. Management has to be visible and has to be very vocal about supporting and vocalizing the importance of safety in our organization. We want to involve all of our employees when we're looking at a culture of safety. And the employees actually have some of the best solutions. If we get our employees involved and actually talk to them about what are some of the risks that they're dealing with every day with some of the tasks that they do, they have a lot of really great ideas. So they can identify some solutions, and then we can work to get a program together to provide training and evaluate how our program is going and what we can do to better our program. So a safe patient handling program is a part of creating this culture of safety. Healthcare employees have a lot of unique risks that are not the same as in other industries. I mean, when you think about a construction worker, when he has to move a heavy piece of equipment, you really never see that construction worker, picking up a heavy beam and just carrying it across, in his construction site. They're using all types of equipment to move things. But think about what us as caregivers, what we do every day. We move people, we help people get up, we help dress them, we help care for them, we help bathe them. And these people, when we're getting them up, they can be in excess of 300 pounds. So we have to lift, reposition, and help these people move in our facilities. And there's some challenges. As we talked about earlier, our workforce is aging. So we have more and more people coming into our facilities, and they're more deconditioned. Our caregivers, all the caregivers that I know are nursing assistants, we have this oath of do no harm, and we always put patient safety above our own. So I think that, when, we look at some people that really need help, we help them as much as we can without using aids because we feel that's our job. And it is, but we can do things more safely with having some equipment. So what happens with safe patient handling programs? How does it help reduce some of the costs and of these workman comp claims, of injuries? Well, we have to look at creating a policy for the program. We also want to look at what type of handling tasks we have in our organization. And do we have the devices that we need to cut down on the injuries and also improve patient care at the same time? Patients, people think that patients are negative about using equipment, but, honestly, they feel bad when, they're of size and we have to move them, and they know it's difficult. So I think it preserves their dignity and makes them feel better and keeps them safer when we use equipment to move them and some aids to help us move our patients. When we don't use equipment, we just use our bodies or manual labor. And what happens over time is, we get these little micro tears, these little micro injuries. And you don't think anything is a big deal. It might be a little sore one day when you move someone, or after a hard day of work of just being very physically involved in caring for patients, and you're just tired and achy. But what happens is these little micro tears can end up in being a much bigger injury in the long run. The longer you do things, the more wear and tear your body takes, and the more injuries that our staff can incur. So using equipment and having some type of aids actually will help reduce some of the injuries. And there are so many wonderful products that we have out there to help us move patients. There's slide sheets, there's lifts, and we're going to go into some of these things that will help us. But the key thing is that we want to keep our staff safe. We want to keep our clinicians safe when they do all these tasks. And of course, we want to make sure that we also take good care of our patients and our residents. All right, so what is best practice? So I looked at some of the OSHA guidelines for nursing homes, and a lot of nursing homes have implemented these injury prevention efforts that focus on properly lifting residents and repositioning them, and using techniques and methods to help reduce injuries. So some of the tools that we can use provide a safer and more comfortable workplace for us. And with the high staff turnover that we have, what's really important now is to have an environment that's safe for our staff. I mean, everybody, well, who doesn't like to work for someplace where it's a pleasant work environment? You feel that it's a safe environment. When we have a pleasant workplace, we have reduced absenteeism, we have increased morale. So we want to develop and have an environment that is safe for our clinicians, and it's a good, comfortable workplace, and they like to come to work. They know that the management is taking ownership of, caring for not only the residents, but their staff. So what we want to do is look at some of the elements now of what a best practice program is. So the first thing you want to do when you create a culture of safety and a safe patient handling program is assess your facility. Take a look at the environment. What is the patient environment look like? Look at the injury rates that have occurred with patient handling in the past, and then identify those high risk daily tasks that we do to move patients. Moving someone who maybe has very limited lower extremity ability, maybe someone who is extremely overweight in our facility, all those types of things, identifying, what are some of these tasks that have caused a lot of injuries in our facilities. Let's take a look at what is actually happening. And then we need to look at, okay, so how do our staff members assess our patients so that they can choose the right type of equipment, and they know how to get our patients up and how to handle them? Well, there are lots of tools that are out there to help our staff assess a patient's mobility, which we're going to talk to a little bit later in this presentation. So I encourage the use of tools to help evaluate patients and their mobility capabilities. And then we need to standardize the process across the facility of how we're going to move patients. How do we make decisions of what equipment to choose? We also want to put in some type of protocols of, okay, when we are getting someone who is very debilitated, and maybe who has some deficits such as with their vision or hearing, deficits involved with their gait, maybe we need to have a two assist. So we want to put these types of standards in place that'll help our staff perform these high-risk tasks safely. So another element to the best practice program creation is to take a look at patient handling equipment. What is available in your facility, and what do we need? So we want to assess not only the environment and the patients and the tasks that we have, we want to also take a look at what do we have available to our staff to help them move patients. And then we want to also ensure that what we do have is accessible to our patients. I'm sorry, to our staff members. Is it easy to get to? Do we have equipment located in convenient spots so that the staff members can grab a stand assist or some type of an aid to help them get a patient or a resident up? And then, of course, we want to make sure that everything is also in good condition. If we have equipment, but it's not working, what's the point of having the equipment? So we always want to check to make sure everything is in good working order. And then it's also important to identify some clinical staff that will take responsibility for looking at those high-risk nursing tasks and nursing assistant tasks. And we want a few people to be our champions that can identify hazards and also make recommendations to our staff of how to move and handle patients. And so we want the same group of people to also work on training our staff. Training is important. We have so much turnover that it's continuous training, and training encourages, someone being comfortable with using the equipment, and also encourages the use of the equipment. And after we perform a certain task and it's been successful, we want to step back and take a look at, well, what did we do? How did this work? Did we use the right equipment? And we also want to take these same protocols and what's worked best for us, and then apply it to other residents and other units or areas in our facility. So I don't know how many of you have heard that another recommendation by OSHA and the VA is to perhaps put something in the policy about minimal manual lifting, or some facilities also have no lift policies. So basically what that means is that, they place a weight limit on what is safe to actually move. So in our industry, in healthcare, there's a limit of 35 pounds. NIOSH has done all of these mathematical equations that, take into account lifting and force, and they've come up with 35 pounds as a safe pound limit for us to move. So when you think about 35 pounds, it's not very much. So if we're going to move a patient, every patient is more than 35 pounds, but even some body parts are more than 35 pounds. So having this kind of a no lift policy just encourages our staff to think about using some type of aids to help them move patients. And again, this all revolves around just keeping our clinicians and our staff safe. We don't want them to be lifting excessive weights or doing more manual lifting than they need to, because this will cut down on their risk for getting injured. So once we get our program together and we look at, the environment, the tasks, we assess our patients, we take a look at what equipment we have. We want to take a look at what we need to do then to start implementing this program. So to sustain a program, we need leadership's backing in this. We want leadership to be involved in all decisions. We want them to be very vocal about creating this culture of safety, promoting how important it is to keep our staff safe. I know that staff appreciates it when they hear from the management of the facility that, they're coming to them, asking them about, tasks that they do every day and what can we help you with? What are some of the things that, we can look at to help you move patients? What are some of the difficult tasks that you have to do? What's out there? And then creating these policies and protocols for implementing this program. And the culture of safety, it's a gradual process. So one of the first things that we talked about is, in your program, it's important to provide tools for your staff members to assess a patient's level of mobility. So patients come to our facilities in all different phases or baseline mobility status, and having some type of a tool to assess a resident's mobility level and what equipment to use is vital. we want our residents to participate as much as possible in their activities and bear weight as much as possible to keep their current level of strength up. But we also want to choose the right piece of equipment to let the residents perform at their current level of mobility. And this kind of a tool that we use, it'll help us establish their baseline level of mobility so that we can work on keeping these patients at baseline and not regressing. So using a tool builds the habit of using equipment to mobilize our patients. It helps avoid the clinician and resident injury because it's consistent. If we use a tool that is consistent, that all the nursing staff and nursing assistants can use to help aid them in determining a resident's level of mobility, it's going to increase that habit of using equipment. It'll also help us determine, what type of activity the resident can tolerate. And in addition to that, another very important factor of assessing a patient's mobility level is determining their fall risk as well. So these tools that we have out in the field, they can help us assess the patient's mobility and their risk of falling. And also it can be correlated to what type of equipment we need to use for moving a certain patient, handling them. And I'm going to show you and talk about two different tools that are out in the industry. One is called the BMAT, or the Bedside Mobility Assessment Tool, that was developed by Banner Health. And then the VA also has developed a mobility assessment and algorithms to help guide clinical staff on how to move patients. So let's take a look at some of those. So here's one. This is a very comprehensive patient assessment. This is the BMAT, or the Bedside Mobility Assessment Tool. This was created by a nurse, a physical therapist, a nursing assistant, and it was created to be performed at the bedside in 4 minutes or less. So it's a very simple tool that we can use to help us determine what type of level the patient is at as far as mobility goes. So as I mentioned, it's a 4-minute assessment. And if you look at some of these steps, the first step is just to have the patient sit up at the edge of the bed. Can they sit up in bed? If they can sit up in bed, it tells you they have some good core strength. If they can't even sit up in bed and they're leaning back, well, it indicates that this patient is unable to sit at the side of the bed, so they have poor trunk control. And then if we ask the patient to reach out and grab our hands and shake it, we can see if they have the capability of paying attention to instruction and being able to reach across their midline. If they can't do these types of activities, then we know, okay, they're a level 1. They really can't assist us very much in their activity levels. And then there are other steps in this process, like have them, if they can sit at the edge of the bed, have the patient place or the resident place both their feet on the floor with their knees no higher than their hips, and then have them stretch one leg to straighten the knee, then bend at the ankle and flex and point the toes. If they can't do this, have them repeat it with the other leg. So this shows that, okay, they've got some lower extremity strength, and it also gives us a little bit of an idea of what their stability level is. So if you look, this also carries across to their fall rate. And also we can attach, we can further go on this level and talk about what type of equipment might be best to use on this type of patient. So the level 1 type of patient who really can't do much, they really have very limited mobility. Well, this tells you here, if they're a level 1, use a total lift with a sling. Or if you're going to boost them up in bed, use a repositioning sheet. So I love tools like this because they're super simple to conduct at the bedside. And then they not only help you determine the level of mobility of the patient, but they go on further and tell you what type of equipment is best to use. So you can see here as if your patient can perform those activities that are required level 1 and level 2, then you go and see, well, can they do even more? And are they a level 3? So this is just basically, looking to see if they have some type of a cane that they use to help them get up. Are they able to get their butt up off the bed? And can they hold it for 5 seconds? And then can they repeat it? So this helps you assess, again, the amount of lower extremity strength they have and what their capability of standing is. So this type of patient may be able to bear weight only on one leg, but maybe they still have some, they still have some difficulty standing for longer periods of time. So when you look at this type of patient, you would determine, okay, this patient might be a level 3. So, well, what's a level 3? Well, this is someone who really can't walk without an aid. So maybe we need to use something to help them stand, like a manual sit to stand. And then you have your level 4, which talks about a patient who's pretty much independent. They are able to do all of these activities. They can stand, they've got some balance. And so maybe this person is someone who doesn't need any equipment. So it just kind of helps you determine what level is this patient at and what can we use as far as equipment to help mobilize them. So here's another comprehensive patient assessment tool that I like. This one's by the VA. This one's also really nice. This one looks at what an independent patient is. What's a partial assist, a minimal partial assist, what type of patient needs moderate assist. It's similar to the BMAT, it's just worded a little differently, but it's another really good tool that tells you, like if you look at number 2, the minimal partial assist, well, 1 or 2 person assist with the use of equipment, manual lifting or catching. So they give you some examples: a non-motorized stand aid, if available and able. Look at a glide board for seated transfers. Maybe that individual might need a little bit of a boost to stand up, so maybe like a motorized stand assist. So these types of tools are available. These are only 2 of the tools that I want to present today, but there are other tools, and I highly encourage you to look at some of these to help your staff determine your residents' mobility levels, and then also to help them determine what is best to use as far as equipment goes. All right, so having some type of a standardized process throughout our facilities is essential to help the staff make consistent decisions about what equipment to use. And really, how many staff members do we need to help perform a task, especially some of those high risk tasks. We want to make sure that we safely move our residents and that we protect our staff. So having algorithms in place to guide our staff to determine what's best when transferring or lifting has been shown to be very effective. So let's look at some of these algorithms that we have for movement. All right, so here's one that was developed by the VA. This is a nice algorithm that just shows some steps here on how to transfer a patient to and from bed and chair and toilet, chair and chair. So it just kind of starts out with, can the resident bear weight? Yes. Okay. Then the caregiver assistance is minimal. Well, if they can't bear weight, okay, are they cooperative? So these are just nice tools to use that we can hang up in our facility or that we can teach our staff. Listen, if you're not sure after you do your mobility assessment, here's something else you can use. This just kind of guides our staff to know what to use and when to use it. So this is another algorithm that our nurses at Medline created, myself and another nurse. We just created this looking at a patient, again, starting at looking at a dependent patient task. So someone who can't help us at all with any movement. And then looking at what type of equipment is available. Is a total lift available? All right. If not, what are some other pieces of equipment that you have? So again, these algorithms they're just nice processes in place that help our staff determine what's best to use when moving our patients and our residents. So to create this culture of safety and implement the safe patient handling program, well, it's more than just purchasing equipment. It's not the only step. in getting your program off to a good start and to keep your program running. We need to have people that are committed to this program, some stakeholders with some goals and objectives. So we have to really get our management staff, our key individuals, which is our nursing staff, our nursing assistants, involved in providing us with some ideas and solutions. And then we want to implement our program after we develop, the policies, the protocols, and we want to do a lot of training when we implement the program. But then we also want to take a step back and evaluate what we've done. Since we've implemented our program with safe patient handling and providing equipment, education to our staff, is there a reduction in injuries that our clinical staff is experiencing? Are we providing a nice workplace and a good environment for our nursing assistants? And do they have the tools that they need to help them do their jobs every day? And then we want to make sure that the staff is compliant. Are they using the equipment that we have? Why or why not? And then if they're not, we want to take a look at, well, what can we do to improve it? What do we need to do to strengthen our program? So it's constant. It's a flow. It's not just putting the program together and implementing it. It's also taking a step back to look at it, seeing what we need to improve, and then retrain. It's a constant process. So when we're looking at equipment, it's really important to choose the right product for the task that we have to do. So when we're looking at implementing a program, we identify our high-risk activities, what we do every day that, may injure our clinicians. So things like just repositioning, getting them up out of a chair, moving them from bed to chair. And we want to think about the products that are right for the task and what the weight capacities are also of some of these products that we're going to use to move our staff. To move our residents, I'm sorry. So it's not only important to have, the right type of equipment, but as I mentioned, you've got to also maintain the equipment. So we want to make sure that it's accessible. We talked about that already. Even if we have some equipment, if the staff can't get to it or they don't know where it is, it's not going to do us any good. So we want to make sure that we have enough for what the staff needs to do. And we want to make sure that we have it in a location that everybody knows where to find it, that it's clean, it's in good condition. And we want somebody to be responsible in our facility to check every day or periodically to make sure that everything is in good working order, everything is stocked as it should be. And then the other key part is training our staff. We want to do training consistently to make sure that everybody is very comfortable with using the equipment, because this is going to increase the usage of the equipment that we have out there. All right, so why should we use equipment and mobility aids? Well, we've already talked about all the injuries that can occur with our staff when they handle patients and residents. There's a lot of repetitive tasks that, create wear and tear on our bodies. And if you've ever had the capability of just comparing, I've been out at the bedside looking, working with patients and residents. And, I have to admit, I was guilty also of just using my own body, just boosting someone when I had to, or helping them up, or just lifting them. And I can tell you, I have incurred these little micro tears. I've had injuries because they are cumulative. And when I compare now, to the way I used to practice to the way I practice now that I've been in, at Medline and promoting safe patient handling and looking at the equipment that's available, I would practice completely differently. I would definitely use the tools that are out there, because I see now over time that I've been a nurse for, several years, over 20 years. And, my body, it has taken a toll. I have shoulder problems, I have neck problems, back problems from doing all of these repetitive tasks. And now that I see what's out there, I have to tell you, I don't think I had all these when I first started in practicing in nursing. And if I did, I would have used them, knowing what I know now, because it not only affects the way you do your job, but it affects everything in your life. You can't go home and play with your kids. because you have a bad back. You have trouble going to social functions where you have to stand because your back hurts, or you can't do the kinds of sports that you used to do, like tennis, because your shoulder hurts. So these micro tears occur over time that can lead to injuries, and using some type of an aid is so beneficial to reducing that laborious task and reducing the exertion that's physically required to move patients and residents. So, research has shown that using some type of safe patient handling equipment does reduce force of activity by 35 to 64%. And there's so many wonderful products out there. So mobility aids do help cut down on the physical exertion that's needed. So what type of equipment is out there and what's needed? Well, there's total lifts. I'm just going to give you a little bit of information about what a total lift is and how it can benefit your staff and your residents. So for someone who is a totally dependent patient, that level 1, who really can't do much. So that level 1 patient is defined as a patient or resident that can only assist with 25% of the activities or less. So that type of a resident needs something like a lift. And I think that our post-acute care and our nursing home staff does an exceptional job actually of using lifts. They work with the same patients over and over. I think you are better at using equipment than individuals and nursing staff and nursing assistants in acute care. But total mobile lifts can be moved from room to room. They can protect the individual that's being transferred because it's safe. You don't have to have 3 or 2 people in there pulling the resident in every direction. You use a sling, lift them up with the lift, and then transfer them safely. So it's comfortable for them. You can also reposition a resident by having a sling that is easily attached that can move them up and down in the bed or transfer them. So the principles of using a total lift, are it's a night. You prepare a care plan. You got to make sure there's enough room to get in the patient for the lift. You want to make sure that you widen the base if you're going to lift a resident. You don't need to lock the casters when you're using a total mobile lift. That's one misconception that a lot of our staff has. You don't lock it because of the principles of physics. If you locked it, the patient would sway a little bit more. So if you don't lock it, the lift adjusts with gravity and the patient's weight, and they don't actually sway as much, and it's not risky. So you can widen the base to lift a patient, but then you can also narrow the base if you need to get through narrow spaces or in and out of a door. So the key thing is that when you select your lift, you always want to make sure that the capacity of the lift is greater than the weight capacity of the patient. So check the patient's weight against the capacity of the lift, and then also of the sling. Okay, in bed repositioning, there are some basic ergonomics and some techniques that you can use to help keep yourself safe when you're repositioning a resident in bed. So first of all, we want to make sure that we have the bed always at waist height for our caretakers. We do want to always lock the bed, especially if we're moving them. We want to grab onto a repositioning device. And we always recommend some type of friction reducing device. And you want to grab with your palms facing down, and then you want to have a minimum of 2 staff members. And we want to keep that spine in neutral position. And we want to boost the patient up together on the count of 3. And we want to also offload that patient by turning them to their side and placing some type of an offloading wedge or pillows to offload that sacrum at about 30 degrees. So for those patients that are partially dependent, so this is someone who has the ability of helping us with at least 50% of the tasks. So this might be someone who they can stand, for short periods of time. This might be someone who also might have some hemiparesis, so like your stroke patient, who might have some hemiparesis on his left side. So their left leg is weak, but their right leg is a little bit stronger. You can use a standing aid to help them get to a stand position. This is one of my favorite devices because it's small, it is easy to use. We have one that doesn't require a sling, doesn't require it to be powered. So I think this is a nice tool to help our staff members get our patients who have that lower extremity weakness, and we can move them from bed to chair. And the nice thing about this is if they're a falls risk, this helps keep them from falling as well, because they're confined in the standing aid, and it keeps them safe. So this is a nice fall prevention tool as well. So let's talk about why we don't use equipment. We know that there's equipment out there. We know it's available. We put this program in place. Well, what are some of the barriers that occur that keep our staff from using equipment? Well, sometimes I hear that the staff just doesn't have the knowledge of how to work the equipment. They don't have sufficient training. They're not comfortable using the equipment. So training is a very necessary part of breaking that barrier of not using equipment and helping people to feel comfortable. Sometimes the staff will say, we only have one stand assist and my coworker's using it for their resident. We don't have enough. I can't wait. I've got to move the resident now. So some people feel that it takes more time to use equipment, but actually there have been studies timing the use of equipment that show that actually if you have to run out to get one of your coworkers to help you move a patient, it takes more time to do that than it does for you to grab a piece of equipment and move the resident yourself. So we got to keep the staff motivated. That's just constantly reinforcing the fact that, you know, if you do a lot of these repetitive tasks and you don't have any aids to help you, you will have a greater risk of getting injured. So protect yourself and keep our residents safe by using equipment. So what else can we do to overcome the barriers? Well, as I mentioned, management is key. We need upper management to be involved and to support our activities and to support this culture of safety. And it's a combination of having equipment, training, and procedures in place to assess our patients' mobility aids. We have to have good communication with our staff about handling patients and understanding what our safe patient handling program is. We have a policy in place. We want you to use equipment. We want to keep you safe. We want to have some champions or some people that are trained that want to have to be leaders in the unit that can help train other staff members that can help new staff members, teach them how to use equipment, and then just work with our staff every day to see if somebody has difficulty or if they need some assistance, they can provide some information on what's best to use to move a resident and keep them safe and keep the clinicians safe as well. So we want to make sure that we have equipment that fits the patient handling needs of your patient population. We want to look at how many patients or residents in your facility that are totally dependent, who are partially dependent, and who are independent, so that we can have the right number of patients. The right number of pieces of equipment for our residents. So OSHA says that their guidelines state that for every 8 patients that need a lift, we should have 1 total lift for every 8 patients that are dependent patients. So they have some guidelines, and then, manufacturers of equipment also have some guidelines that OSHA has created they can share with you to help you determine really what's the correct number of equipment and types of equipment you should have at your facility. And the last thing is training. Training is so essential. It's constant. We have people that are constantly coming into our facility that are new. So we constantly need to retrain. And then the people that do the training, they get stronger, and it gives them an opportunity to have some, leadership responsibilities as well. So training is definitely the key. So looking at all of these elements for a safe patient handling program and what is necessary to create your culture of safety going, there isn't a one size fits all. I wish I could say there is, but there really isn't. You need to take a look at your individual facility. Again, look at all those different elements. What's the environment? What types of residents do you have? What are some of those tasks that the staff is having difficulty with? And then, plan to look at different equipment and aids to help your staff do their jobs safely and to move your residents safely. And it's best to pick those elements from these programs that fit your patient handling needs of your patient population. So overall, you just want to tailor everything that I've talked about so that they fit into your organization. So I'm going to end the presentation now. I'd like to thank you for listening and also address any questions that anybody may have.
Thank you so much, Barb. So if you do have a question, again, we want to remind you, you can use the Q&A box at the bottom to have to pose your questions to us. Of course, we're going to share this recording and the handouts will be available to you. So if you do have any questions, we encourage you to go ahead and use the question box right now, and we will be happy to address those and have Barb answer those for you. So while we're waiting to see if we've got any questions, if I'm going to just, Sarah, if you want to jump to the next couple slides, I'll go ahead and remind folks. Our next, go back one if you don't mind. Our next webinar is going to be on March 8th at 1:30, How to Be an Inclusive Leader, Your Role in Creating a Culture Where Everyone Thrives, talking about diversity and inclusion programs. So we hope you'll participate in that. You can register at our website, fhca.org. Also, we have our emergency management and life safety and emergency management summit coming up in April. We've got an in-person option and a virtual live broadcast for that program. So this is really geared towards your administrators, your maintenance, plant operations managers, really all of your teams that are involved in your life safety and emergency management. So we've got a great lineup of speakers, including representatives from the agency, our local healthcare coalition. So I definitely encourage you to participate in that. We are also still looking for photos for your long-term care photo contest. I know y'all are doing amazing things in your care centers, and I see our former winner on this webinar, Shelly Kane, with the Chester Sims Nursing Home, Veterans Nursing Home in Panama City. So you could be like her team and win $500 towards your care center by submitting your amazing photos. So I encourage you to participate. Deadline for that is February 27th. And then we are still raising money for the Scholarship Foundation through our Valentines through the end of the month. You can do a $10 Valentine and show some long-term care love to one of your colleagues. And that money goes towards the foundation where we give scholarships. The next deadline for scholarships is April 30th for both the Bruce Taylor and the Career Climb. This is your employees who might be pursuing careers in nursing or even non-nursing careers. This is a tuition reimbursement scholarship. So definitely share that information with them. And then just a final reminder, something new online is our student membership. If you've got volunteer students, interns or volunteers who are working in your care center or non-paid positions in your care centers, we have a $25 membership for them. They can get a benefit with all of the resources that FHCA has to offer, including access to Deborah Franklin, who connects our administrators in training with preceptors. So you can just wanted to share this if you had any students you had connections with. So I don't see any questions in the question box. So with that, I just want to again thank Barb, our speaker, for this presentation. Great information. Definitely want to encourage you to share it with your risk managers, your clinicians. I see lots of administrators on here, so great job for participating. So thank you, Barb, and our team at Medline. A recording of the webinar will be posted on our website as well as on our Caregivers Florida program, which is the Florida Care for the Aging website. And thank you all again for participating, and we look forward to seeing you at our next program.
Thank you all very much.